All right, so it is all the chapters from week 1, 2, and you will be ready to go. Let me just open up my PowerPoint. Any questions? 50 questions, select all that apply is on there, so make sure you know them. It will be content like what we sort of talked about in my class, and then we'll continue on with some other stuff, but let's take a look at our PowerPoint. All right, so when we're looking at evaluating a community, this is important. We're going to take a look at, just hold on, sorry, it's taking forever. I know. Are we looking at community? We look at preventative behaviors. We will look at, here, I'm going to open in PowerPoint, hold on. Sorry, it's not opening for me. Hold on one second. All right, there we go. So when we're looking at a community, we're going to be evaluating certain things in that community. We're going to take a look at the health status and knowledge, right? What does the community know? We're going to look at things like what's preventative, what's going on in the community to prevent things from happening. Or we have playgrounds, we have lights in the streets. Do we have driver programs? All those are going to kind of generate when we're looking at our community. We look at patient rights, something that you guys should know about, ethical issues related to abuse and screening. We have two different types of community-based nursing. We have community-based nursing and we have community-oriented nursing, which is going to be our base we talked about in class. Those who are ill, and then community oriented is on the healthcare of everyone else. So we're going to make a nurse who's demonstrating community-oriented nursing will evaluate the risks of the families, individuals, the groups, whoever she's around. Okay, so those are two major concepts there. No. Also, we're going to take a look at our preventions, our primary, secondary, and tertiary. Remember, we talked about this. Primary is prevent, secondary screen, and tertiary treat. And you're going to have examples. You're going to have to apply that. Okay, so make sure you're prepared to apply that knowledge. When it comes to smoking and chronic illness, what are we going to do with primary and tertiary prevention? What can we do as a community for that, for smoking and kids with, say, asthma? What can we do for primary prevention?
Educate on like the dangers of smoking so they hopefully don't start.
Yep, we're going to teach our kids good dangers of smoking. Now we have a chronic condition though. So now what do we do for tertiary?
Probably perform a spirometry test.
Good. And we're going to teach them on their inhaler use, right? Make sure they have access to it all. So we're going to do our disease prevention and promotion. Next couple slides are going to be about Medicare and Medicaid. We didn't really cover this in class, but we are going to cover it now. We know Medicare, people caring for those 65 and older. Medicaid is going to be our low income levels and those that are classified as disabled to work. So that's going to be our aid. We're going to give them help. Okay. And so we have two different healthcare systems. We have private, which is like our primary care, and then we have public, which is run by the government, like our Medicares and our Medicaids. Okay. Healthcare costs. We talked about our social determinants of health in class. Please remember those. It's going to our economics, our environment, our neighborhood, all those kinds of things are going to be impacted, right? Our education is going to impact how do we get and how do we have money. If you don't have money, it's kind of hard to prioritize your health care, right? We had an Affordable Care Act that was passed by Barack Obama, and that was to increase those who could afford health care. we were to increase our quality and lower our costs. What we do know, the United States pays higher than anywhere in the world for healthcare, but it doesn't do much because our indicators are not that great. Okay, so we spend a lot of money and don't get much out of it. Some acts that help with public health care we want to think about is our Family Medical Leave Act, right? We have the World Health Organization, who's going to help regulate events such as pandemics. We have American Disabilities Act, so those people that are disabled are able to get jobs, and you can have protection for them. And then we have QCEN, our Quality and Safety Education for Nurses. This is not a federally moderated organization, but what does it do? It's quality and safety for nurses. So what do you think it focuses on?
Maybe probably,
Evidence-based quality.
Yeah,
any
good.
kind of tool to avoid maybe malpractice.
Good. It's going to be safety and education. That's what it is. It is not a federally funded program or organization where the other ones are. Okay. School nursing, what do we look at? So we know school nurses are primary, and any nurse, it doesn't matter what kind of nurse, is going to be our ABCs, right? Our airway, our breathing, our circulation always trump everything else. Okay, so if somebody comes in with asthma, or somebody comes in with a scrape on their knee, or somebody comes in with a headache, who's going to be our priority? Asthma, scrape,
Asthma,
headache.
because it's gonna be airway, breathing.
Yep. Yes, perfect. Airway, so would it be airway, breathing, circulation? Remember those three, okay? Because there may be a question about who should the nurse see first. Okay. All right, we know that we talked about this in class that we're trying to get those asthmatics back in school. So here's some things Healthy People 2030 likes to do: routine vaccine coverage for adolescents. We're gonna see if reduce the number of school days or work days missed for those with asthma, right? That's important in our schools.
Mhm.
Okay, and then we take a look at, oopsie. Evidence-based practices slide should look familiar to you guys. We did this in class, right? We know evidence-based, they look at what's going on, they look at studies, they say, how can we make nursing better? We always have to figure out, what are we doing before we do the research? What are we looking to find, right? That's most important. And use of clinical trials that are randomized here are high. You know, the more random they are, the more you have, it's going to be a higher rate of success, or not a higher rate of success, a higher level of study, okay? So those little ones at the bottom, are like expert opinions, that's like nurses, doctors, whatever. And then you go all the way up to the tippy top, and that's going to be your highest level, okay? Your qualitative studies is always your highest. And that's going to be a bunch of studies with data, and you have your answers, okay? Well, understand why a nurse would choose public health. Public health has a lot of autonomy and a lot of independence, meaning you can do it on your own. You can go to people's houses. You can go out in the community. You can do vaccine clinics, all this kind of community stuff. You're going to have a lot of autonomy and independence. We talked about medical homes and how that helps with our chronically ill, right? And here I'm emphasizing again our community-based nursing, that base where they have something wrong with them, and we have community-oriented. So you'll see that twice in my review. That's emphasizing you really need to know that. Okay. We took a look at our health disparities. Sorry, this is so small. Let me see if I can do a slideshow. All right, our health disparities. So we know our largest impact is money. We have higher chronic diseases, less follow-up with our vulnerable populations. We take a look at education. What do we know about education? Low education, poor health, more stress, more problems. Physical environment, we look at our water, our air, our workplace, our homes, communities, good employment and working conditions. Health services, do we have access to it? Do we have social supports that are going to be helpful? Okay. Do we have a family? Do we have friends? Do we have a community? We also know gender plays a part here. Men and women suffer from different types of illnesses at different ages. Okay. Vulnerable population. You guys saw this slide earlier tonight. Vulnerable population is a subgroup of the population that result to have exposure to risk and have worse outcomes. Okay, so they're going to be exposed to more and they have worse outcomes. Why? Because of finance, because of diet, because of genetics, because of social and environmental. Right? They're going to be more at risk. Oopsie. What does public health do? Our primary goal of public health, prevent disease and disability, okay? We're going to promote independence. Public health nurse has a population-focused practice, meaning they work for the populations. Help to understand problems and solutions of a defined group, such as gender, age, or race, aggregates, families, and individuals that increase risks. We have public health policies that create health standards to decrease our mortality. We know our mortality wants to go down. The leading cause of mortality has shifted to chronic diseases, and population of the world is increasing and decreasing mortality rates. So people are living longer. We see our largest impact is our economics, which we talked about. Healthy People 2020, what's our goal? Our goal is to have health equality and social determinants of health increased so that they are equal among all. Okay. So our goals for Healthy People 2030, attain lives that are well-being and free of preventable disease and disability, eliminate health disparities, create social, physical, and economic environments, promote healthy development behaviors, and engage leadership and public to design policies that will improve overall health and well-being. With family, we talked about this quite a bit. Family is unique. It's determined by whoever it is, wherever. Remember, healthcare is a function that where you take care of one member of your family. Healthcare function is when you take care of one member of the family. Okay, think about delegation and prioritization when we're looking at our healthy versus unhealthy, functional versus dysfunctional families. There's a chart in your book that I want you guys to review. It's like what makes a family healthy: spending time together, each person talking to one another, the kinds of things that you're going to watch out for. What is a family crisis? We know a family crisis occurs when a family cannot cope with an event and they'll say, I can't do this, I'm done. And hopefully we're going to help them with their resources when they go through these family crises. We have two different pieces that we look at. We look at genomes, which are going to be our genetic stuff, G for gene, and ecomaps, which is going to be out about our relationships and who's in our environment. Like, who do we interact with? Who's our church? Who's our social clubs, organizations? Okay, so we have genomes, genetics, ecomaps, environmental of who are we with? Home visits we talked about in class. Understand why home visits are the best for a community. Think what are some advantages and disadvantages, and a community nurse overcomes barriers with good communication. Assessment is interactive. You need to make sure don't disclose too much because you'll scare them away. Slow the process. Take your time. Before the assessment, remember you're going to review what's being done, why, preferred time for the family, purpose of the visit, and try to have the whole family there because you get a lot of info that way. Okay. We looked at this earlier, our infants and our SIDS. We have SIDS and abuse is what we're worried about. 1-year-olds are most likely, as we talked about in class, because they scream a lot and you don't know what they need or what you can do for them. Look at common areas, safety for kids. Make sure those with a chronic illness will have a medical home. And our adolescents, we worry about car safety and suicide. Okay. Stress management is a tool that we use as a good technique. Young kids, we're going to talk to families about drugs and alcohol. Guns and safety, make sure they are stored and locked up, right? Be careful that we do not mix substances with possession. So these are the kinds of things we would teach our families about gun safety and security. What do you think you'd teach them about drugs and alcohol? What are you going to teach families about drugs and alcohol?
Probably the risk of develop chronic conditions due to the consumption of these substances.
Good. You're going to worry about what could happen if they take them. We're also going to, go ahead.
Please, cirrhosis.
Yeah, cirrhosis. That's a good one. And how about mixing drugs and alcohol? We're not going to do that for sure, right?
Interactions with medications
safety.
they might be taking,
I'm sorry.
and interactions with any medications they might be taking.
Very good. There's one that really interacts with alcohol. Do you know what it is?
Opioids.
Yeah, the ones that depress the central nervous system. Because alcohol depresses it too. So what do you think is going to happen if you take alcohol and one of those? Not a good outcome, right? So good. Think about those kind of things. Healthcare decisions and families. I want you to know about these 4 different things. You have durable power of attorney, which is the way a client designates someone to make healthcare decisions. Advanced directive, which is going to be living will and durable power of attorney. So they both are considered that. Living will allows the client to express wishes regarding the use of medical treatment. And a DNR, we know what that is. Do not resuscitate. Oopsie. When we look at our school nurses, they treat emergency medical needs in schools. They teach injury prevention measures, and they diminish our environmental risks to kids and to teens with obesity and nicotine. So they're really important part of the community. No, we have ethics that guide our practice. We have moral dilemmas. We have the Nurse Practice Act, which protects the public by setting qualifications to nurses from state to state. So it's a Nurse Practice Act. It's going to protect the people by giving nurses things that they can and cannot do. Okay. That's the end of my slideshow. Any questions on that content? I know that was pretty quick, but I tend to go through them pretty quick. What kind of questions do you have on the study guide? What kind of questions do you have in general?
So do you think that the recording is enough for the exam to pass, or do we need to go further?
I would attend every exam review. I would, if you give me one moment, I'll review some questions. Okay, I'm gonna do some questions. I wouldn't say that you can exclusively rely on that. What I can say is rely on your study guide is usually your best bet. I cover content in that's on your study guide, but I wouldn't just say attend one and you're fine. You got to really know this content down. You're going to be applying it, okay, in your practice. So that's how the questions will ask, kind of like not case studies per se, but similar.
Okay.
Okay, I'm just going to look at something real quick so I can give you guys some more pointers. Right, so we're going to be looking at, like I said, school nursing, families. We know what to teach and what not to teach, right? Interactions with our drugs, our ethics is important. We know we practice nursing with our ethics, and that's always key to remember. I'm just looking at some of the things here. All right, you'll have. mm, when we're looking at the community, what kind of criteria are we gonna look at? What are we gonna be examining? Remember, that was our first
Vulnerable
slide.
populations,
The population, safety, right? Our safety, our playgrounds, our driving programs, our
Preventative
lighted
behavior.
streets. Yep, preventative behaviors, very good. Let's see here. Oopsie. Public health nursing, we have, primary, secondary, and tertiary. What do they help us do? They help us prevent, they help us protect, they help us,
treat.
yeah, treat. Those are our three things that they do for us. And I told you to make sure we know the difference between community-based and community-oriented.
Can you go over that again?
Sure. So community-based has a base to it. That's how I want you to remember it. So community-based is when somebody's got something wrong. So you're caring for those acute, those sick people that have something. And then community-oriented is going to be where you're taking care of the community as a whole. You're doing preventative stuff. You're doing kind of like it's kind of how you can practice nursing, two different ways, right? You can either take care of the sick or you can help keep the community healthy. Make sense?
Thank you. Yes.
Yeah, sure. So you'll have one question on that I know. And we talked about Medicare and Medicaid. Any questions on Medicare and Medicaid? I'm trying to think what you mean. We know that our health costs are higher in the United States than anywhere, but do we have good outcomes? Nope. Not good outcomes. Our Affordable Care Act, what did that do? What did it increase?
The access to health.
Yep, access to
the
healthcare and
right? You mentioned it.
yep, and we also improved our quality, right? We tried to get better healthcare. That was the goal of it. With our evidence-based practice, we're going to take a look at evidence-based practice and we're going to see what do we need to do before we start the research?
Figure out what we're looking
Define what
for.
we are looking for.
Very good. You're going to check out what you're looking for. If we're doing evidence-based community, what we are going to make sure we are doing is we look at what's currently going on. What are some things that will come up as barriers? How can we prevent those barriers when we're doing this investigation, okay, and evidence-based practice? You'll have several questions on it. So what we do with our evidence-based practice, how do we figure out what to do? What do we use to determine what we should do? You remember? We use those studies, don't we? We look at the results of the studies to figure it out. Right? What are some risks that vulnerable populations face?
Financial,
Good. What
safety,
else? Yep, safety. Remember, we have finances. We know diet and exercise is compromised oftentimes. Genetics might have something to do with it. We have violence sometimes. Remember our environmental hazards, those social determinants of health, all those things we're going to look at with our vulnerable populations. Okay. And our goals of Healthy People 2030, we sort of spoke about this. What are the goals really? What are we trying to do?
To have a healthcare access in the same way for everyone.
Yeah, we're
Something
gonna make
like
sure
that.
we're gonna have that health equality, right? We want healthcare equal. We want to address those social determinants of health so that we can make sure that everybody has health care where they can. When we know, working with families, what do we want to do? What do we want to focus on with our families? Do we want to focus on things they don't do or things they do?
In the day to do.
Yeah, things they do. You want to emphasize their strengths, right? And tell them how good they're doing with that. When we have a daughter take care of an adult, what kind of function is that called?
Caretaker?
No, remember, it's called the healthcare function.
Oh,
It's part of that family, healthcare function. We always want to see with the healthy families that they're talking to one another, they're listening, right? Before we meet with them, we want to make sure, I'm going to reemphasize this again. I've said this is about the fourth time. Why we're getting it, the most convenient time to visit, the purpose of the visit, and who can be available, right? Those are really important when we're doing family assessments. Because you want to know why they're coming and what you're doing. Does that make sense? Let's see.
Question, is it time convenient for them or time convenient for us?
Nope, time convenient for them.
Yeah, okay.
It
That's,
won't be specific, but you know, it's for them. Because you don't want to go like in the middle of their dinner, right? Because they're not going to pay attention to you. Or you don't want to go when nobody's home or something like that, right? So just kind of like common sense for that one. When we're looking to do risk reduction with guns, what are some things we could say to them?
Keep it in a locked, like gun safe.
Yeah, we always want to
Ammu-
make sure it's locked. Yep.
ammunition separate.
Good. Ammunition separate. We're gonna make sure that we emphasize that we're locking them up. Okay, guys? Lock those guns up because we don't want anybody getting their hands on them, particularly little people. All right, we have childhood obesity is a concern among our kids. So we want to remember that. How are we going to help reduce that? What kinds of teaching are we going to do for the families?
Diet and exercise.
Yeah, diet, exercise.
Free screen time.
Good. Yeah. We're going to make sure that they know that's important. In today's day and age, some people don't know that what healthy eating looks like. So sometimes I have to teach that to them, right? That's okay. What do we know about car safety? Who do we worry about with car safety?
The
Everyone.
use of seatbelts because car accidents are provoking, injuries.
Yeah, but we're gonna worry about our adolescents, right? Our adolescents. We talked a little bit in class about a sexual conduct during adolescence. We want to really teach them about safe practice, right? Feel comfortable. We know that among our adolescent population, we're looking at car safety, suicide, and violence. Okay, that's our most important. We talked about a medical home. Let me see some things on ethics. What are we going to ask? Okay, so I want you to know durable power of attorney, right? Went through that. And then I want you to know that's important. And DNR. We all know what DNR is, right? Do not resuscitate, no CPR. We have a couple of different questions on levels of prevention. And we may see that in the school setting. Okay. If we were to put something up where we were trying to educate our kids, what kind of things could we put up that would be education for our teens? Like, what could you put up?
Safe sexual practices.
Good. What else are we worried about with them?
About substance abuse and consequences.
And smoking, right? Yep, smoking, just substance abuse. So you want to put something up in you so that they don't do it, right? So you put up in the schools, don't do it, or social media, however you can access it, and so that they don't, okay, engage in that behavior. Does that make sense? That's really our goal, is to prevent them from engaging in the behavior. All right, any other questions? We kind of summarized it. I went over some good questions with you. You guys seem to know, okay? So make sure you know what you're looking for in communities, family. Everything we talked about, okay? You guys will do fine. I'm free for a one-to-one. If you want it, just give me a shout out on my email, okay?
Okay,
All right, have a good night, everybody.
Thank you.
thank you,
Much,
Professor.
you too.
You're welcome. Bye-bye.
Thank you, bye-bye.
You're welcome.